Hello. How do you diagnose diabetes? How do you know when you are diabetic? There are key criteria that's usually could confirm indeed that somebody is diabetic. First of all, there should be some symptoms of excessive drinking of water, excessive thirst, excessive urination, and weight loss. Those are the symptoms associated with diabetes. So in addition to these symptoms, the person who is also diabetic should have elevated blood sugar. Now we have the random blood sugar, which is the one that you do when you have eaten, and we have the fasting blood sugar, in which you have fasted for about 8 hours before you do the test. For the random blood sugar, if your random blood sugar is about 200 milligram per day or 11.1 millimoles per liter, that's diagnostic of diabetes. Or if your fasting blood sugar is 126 milligram per day or 7 millimole per liter, that's also diagnostic of diabetes. So in the presence of symptoms of excessive thirst, excessive urination, and weight loss, in addition to that, elevated random blood sugar or elevated fasting blood sugar, as I've described above, you can confirm diagnosis. But apart from this also, you may also use the glycosylated hemoglobin, which called the HbA1c. If you have a HbA1c of 6.5%, that's also diagnostic of diabetes. So, but if you don't have the symptoms, you're not having excessive urination, there is no excessive thirst, there's no weight loss, but you have elevated blood sugar, random blood sugar, or the fasting blood sugar, then you may want to do the test. You do alternate tests. That means you have done random blood sugar, it is high. You have to do maybe like HbA1c, and if it's also high, and give a space of about 24 hours in between these two tests. The test will not be the same test. It shouldn't be the random blood sugar you're going to do after 24 hours. You can do random blood sugar, and then after 24 hours, you do a HbA1c. You do an alternate test. In the absence of symptoms, and you get the values that is high in these two tests, then it is confirmed that you're also diabetic. It's important for you to know what to expect when you're already diagnosed with diabetes. What should be the normal range you should be expecting to show that your control is good. You want to observe that whenever you are fasting and your blood sugar is between 80 to 130 milligram per day, that is also showing you a good control. Or you have eaten a random blood sugar check as a diabetic person and you get values up to 180 milligram per day or lower than that, then your control is fair enough. So please keep checking your blood sugar and keep monitoring it very well to keep away complications that may come from poor control of your blood sugar.